All right, guys, welcome to week 3. Today we're going to be looking at the heart, and we're really going to be tying the anatomy of the heart to what we already spoke about in lecture. So we talked a lot about the function, the cardiac cycle, the electrical activity, the conduction system of the heart. And so today we're going to really bring in the anatomy. So what are the structures that are involved in the cardiovascular system, specifically in the thorax region? So we start off with the thymus, and the thymus is a lymphatic organ that is found anterior to the heart in the anterior thoracic cavity. It's a lymphoid aggregative tissue. It is where T cells go to mature. This happens early in life, usually before or up until the time of puberty. And so we have a nice large size thymus in younger adults and younger children, but by the time a person has passed puberty and is into early adulthood, the thymus involutes or shrinks and is replaced by a fatty mass of tissue. And so that's the thymus. It's usually found kind of wrapped around the great vessels around the top of the heart. Again, it's not going to be very visible in older persons, in older cadavers, but we do see a few thymuses if we find younger cadavers, and it does involute beyond young adulthood. Let's move into the mediastinum. So the mediastinum is this region that we define that is within the boundaries of both lungs and is posterior to the sternum, but anterior to the vertebral column. So this kind of confined space here, right where the heart sits, this is what we define as the mediastinum. Important structures that we can already see in the mediastinum are the pericardium. So the pericardium, also called the fibrous pericardium, is the sac in which the heart sits. It's a connective tissue structure that is wrapped around the heart. It is protecting the heart. There's a tiny bit of fluid within the pericardium that is helping to reduce any friction with the movements of the cardiac cycle. We've also got the phrenic nerve on the lateral aspects of the pericardium, and the phrenic nerve is innervating the diaphragm. So we see it running through the lateral aspects of the mediastinum here on the lateral aspects of the pericardium and making its way down to the diaphragm. Now, the phrenic nerve is really important in terms of cardiac surgery or any type of thoracic surgery, because this is the nerve that controls the diaphragm, which is the muscle that controls our breathing. And so surgeons, clinicians want to be really careful when there's any type of surgery being done in this confined space, not to nick or injure this very important nerve. So let's kind of define this space here a little bit. So the heart is located posterior to the sternum. It's going to be in between both of our lungs, but it's going to be slightly askew to the left and more on the left side, kind of invading the space of the left lung. It's 4 chambers. There are 2 receiving chambers called atria that are pretty much on top of the heart. We'll talk about what that region is called. And then there are 2 pumping chambers that are ventricles, and they really make up the bottom, the base, and the apex of the heart. So let's define some of these surfaces of the heart. So we've got the base of the heart, and the base is really the top, not what it kind of sounds like. So the base is on top, and this is where we see these great vessels that are leaving the heart. So we can talk about the pulmonary artery, we can talk about the pulmonary trunk, and then the branching pulmonary arteries, the arch of aorta, and then the main branches there, and then the superior and inferior vena cava. So here is the base of the heart. Alternatively, the other side of the heart is called the apex. So the apex is going to be the pointy region that is inferior. It's going to be slightly askew to the left, and it's kind of this pointy region that's formed by the left ventricle. The surfaces of the heart are the sternocostal surface. So the anterior-most surface of the heart is called the sternocostal surface. This is the surface that comes in contact with the sternum and parts of the costal cartilage, hence the term sternocostal. We've got the diaphragmatic surface of the heart, which is the surface of the heart that sits on the diaphragm. This is going to be the bottom of the heart, mainly formed by the ventricles, so left and right ventricles. And then we've got the pulmonary surfaces. So the pulmonary surfaces are really the angles of the heart on either side that come in contact with the right and left lungs. On this slide, we also want to point out the ligamentum arteriosum. This is a connection between the arch of aorta and the pulmonary trunk. This is actually a remnant from fetal circulation. So during fetal circulation, when an infant is in utero, there is an artificial communication between the aorta and the pulmonary artery. The purpose of this communication is to bypass the lungs. So as a fetus is not able to bring in oxygen, there's no need for the vasculature to circulate to the lungs. And so to bypass that circulation, blood that's leaving the right ventricle goes into the pulmonary artery and immediately into the aorta. After birth, this artificial communication is then closed, and what's left is called the ligamentum arteriosum. So this is a adult remnant of what used to be a fetal communication. Let's look at some of the main vessels that are found in the base of the heart that we began speaking about. So we've got the brachiocephalic veins. And if you look at the word brachiocephalic, this is going to tell us what areas are being drained by these veins. So brachio is referring to the arm, cephalic is referring to the head, and this is the region that's being drained by the brachiocephalic veins, the right and left head and arm. So basically the entire upper body drains into these veins from either side, and then both brachiocephalic veins communicate into the superior vena cava, which communicates into the right atrium. All right, now in terms of the surfaces of the heart, there are several grooves that we call sulci. And these are the grooves where the coronary vasculature is located. So we've got the coronary sulcus, sometimes called the atrioventricular sulcus. The coronary sulcus is a groove that sits between the atria and the ventricle, and it's going to wrap all the way around the heart. So back here, we can also see this groove as the coronary sulcus. On the anterior surface of the heart, there's the anterior interventricular sulcus. This is a groove that separates both ventricles, hence the term interventricular. It's also a representation of the septum beneath. This is where some important coronary vessels lie. We'll talk about what vessels lie in the anterior interventricular sulcus. And then on the posterior surface of the heart, we've also got the posterior interventricular sulcus, which also has distinct vessels residing or lying in this space. So it's really important for you to associate each of these different sulci with the corresponding arteries and veins that can be found here. So really straightforward, we talked about the chambers of the heart already. So we've got two atria, right and left. These are on top, these are the receiving chambers. And we've got two ventricles, right and left. These are on the bottom, these are the pumping chambers. So I want to distinguish the difference between the right and left ventricle. So the right ventricle is going to be slightly smaller in terms of the thickness of the wall than the left ventricle. And this is because of the resistance against which the left ventricle pumps. So the left ventricle is facing or working against the resistance found in the systemic vasculature, whereas the right ventricle is working against the resistance in the pulmonary vasculature. And so this is evident in the size of the muscle thickness, the size of the myocardium of the left ventricle. We can see that that is substantially thicker on the left side. In terms of the location of the atria, we've got the right atrium, which is usually right on top of the right ventricle. And then the left atrium is usually kind of hidden. It's kind of towards the back of the heart and kind of covered by the pulmonary trunk. Okay, let's talk about these structures here again. So we've got the auricles, and the auricles are kind of these accessory chambers to the atria. The auricle on the right side is going to be larger than the auricle on the left side. And if you think back about the word auricle, we talked about the auricle of the ear, which just means appendage or accessory flap-like structure. And that's exactly the definition or kind of the description that we see here for the auricles of the heart. They're kind of these appendages, and their function is to be kind of a reservoir for excess filling of the atria. So because the atria are filling chambers, they are receiving blood that's coming back either from the pulmonary vasculature or from the systemic vasculature, depending on whether it's the right or left atria. But because they're filling blood, they have this little appendage which allows them to kind of fill excess volume if there's excess blood being returned to the heart. And this is the reason why on the right side we have a larger auricle, because the right side of the heart is likely to be filling more volume that's coming back from the systemic vasculature. All right, let's get into the valves. So valves are these flap-like structures, right? They are separating the flow of communication from atria to ventricle and from ventricle to artery. The valves help to keep blood flowing in one direction. So they help to maintain unidirectional flow from atria to ventricle or from ventricle to artery. So we've got two atrioventricular valves. On the left side, it's called the bicuspid. On the right side, it's called tricuspid. And the reason that it has an extra cusp on the right side is because of what we just talked about, because of the propensity for excess volume coming back to the right side of the heart that is not seen so much coming back on the left side of the heart. So there's an extra cusp found in the atrioventricular valve on the right side, whereas the left atrioventricular valve only has two cusps, hence the term bicuspid. The semilunar valves are separating the ventricles from the arteries. So on the left side, we've got the aortic valve separating the left ventricle from the aorta. And on the right side, we've got the pulmonary valve separating the right ventricle from the pulmonary artery. And here we can see those two valves. So here goes the aortic valve and the pulmonary valve.